Hi, my name is Herni. I come from Indonesia. I've been volunteer to Muhammadiyah organization, and my organization established in 1912, and we work to improve the quality of life of people.
And I'm Claudia Cabral. I work in Brazil, and I work with Terra dos Homens, Brazil. We have been working for 16 years with children in streets, children in institutions, and always reinforcing family bonds. We received a proposal to make a research of the social work in Brazil. And so we chose 2 municipalities to make researches with them, with children, with the workers, with stakeholders on how social work in Brazil is being implemented. We are still at the end of the research. We have raised some good results, and now we are validating it with the social workers. Next month we will invite those who are really on the ministries and on the secretariats, local secretariats, to see the results. And after we validate it, so we will spread the content, and I think there are important points that we must still think on. For example, we are a huge country, and things must happen on the municipality where children are. So we must in Brazil invest more on the municipality of the decisions, and we must reinforce how to improve more social work on the local base. This is one of the points. Another point, for example, that research pointed is social workers sometimes do administrative procedures, and so we lose competences. I think if they were in number enough, and they could do their work directly with children instead of being on administrative responsibilities, we could perhaps reach more results.
Yes, as we know that in Indonesia we have a lot of institutional care. We have a lot of children lost parental care, and we are now on our beginning to start the institutionalization process. But I believe that the institutionalization process needs to support from the main stakeholders such as social worker, because the social worker is a professional person who can outreach the children, and they can monitoring and evaluate the children when they are coming back to their house. I'm worried that actually the institutional care, they wouldn't be care anymore after the children reintegrate, because the institutional care will assume that they are not longer have responsibility for the children. So the social worker, they have to do that to ensure that the children get their access to study, to schools, to nutrition, and to the others. And I think also the social worker need to help the parents how they can prepare themselves to provide to accept their children again, and how to make sure that the relation between the children and the parent running well, because some of the children who already come back to their host, they seem so awkward with parents, because it has been very long separation. Yeah, I guess in Indonesia the social work assessment will be aimed 2 things. First is how to find out the capacity of the social worker, and how the stakeholder in charge know about that. I mean, such as social ministry, how well they prepare about the regulation, and for the university, how they prepare well about the social social work student, something like that. And the second aim could be learn from the Brazil experience on how the social worker involved with this activity, and also how the assessment could be done.
So we have a person that worked in ABTH with us for a lot of years, and now this person is coming to Indonesia. She has done the research in Brazil, so she's Adriana, and she is going to Indonesia. She will share with them how was the social work assessment, the results, how Brazil implemented this, and after we are continue talking about the possibility of our government to go there to talk about the with the government and
government to government relations.
Yes.